This is Audible Bleeding, the Vascular Surgery Podcast. We're here to help you keep your finger on the pulse.
Welcome back to Audible Bleeding. We are excited to bring you some highlights from VAM 2019. We're here with Dr. Dawn Coleman. Welcome to the podcast. Dr. Dawn Coleman is an associate professor of vascular surgery and the program director of the Integrated Vascular Surgery Residency Program and Fellowship at the University of Michigan. She's also a lieutenant colonel in the Army Reserve. She's interested in physician well-being and resiliency, and given her background in military service and surgical education, she presented a report from the SVS Wellness Task Force on vascular surgeon burnout this past Thursday. Thank you, Dr. Coleman.
Thank you for having me.
So can you just describe the methodology of your survey a little bit for our listeners who weren't there?
Absolutely, thank you. We were very careful to work with well-recognized experts in this field and specifically aligned ourselves with the Mayo Clinic and Susan Holbeck, also Tate Shanafelt from Stanford. And so with collaborative experts in this domain, we fashioned a survey that included validated metrics for emotional exhaustion, depersonalization, and burnout. But then we expanded on the survey tool to allow us to capture things we felt were unique to our specialty and might distinguish why our numbers or our risks are different than other surgical subspecialists. What was also really impactful was the ability to capture free text responses from our membership to identify additional themes for follow-up.
What were some of the take-homes of this?
Take-homes from the survey were significant, and I would suggest that it's a bit of an uncomfortable domain for people to talk about. But essentially, we have membership, 40% of whom meet criteria for burnout, qualified as high scores on depersonalization and emotional exhaustion modules. We also identified that more than 30% of our vascular surgery workforce suffers from depression really in the last 12 months. And if you look at those physicians who met criteria for burnout, that incidence was increased twofold. And similarly, 8% of our workforce has described suicidal ideation just in the last 12 months. And again, if you look at those surgeons who meet criteria for burnout, the incidence is doubled to 15%.
Wow, that is some sobering information. What do you feel are the main drivers of burnout?
There were trends on univariate analysis that I think many of us would assume related to work hours and to administrative burden. But really what bore out with the multivariate analysis included risk factors like a work-life imbalance, and specifically when there's a conflict, having that conflict favor work. We also saw a strong predictive factor with chronic pain, which links nicely to the data Max Wollauer presented today.
Were you surprised by any of your findings?
I don't think I was surprised by any of our findings. I was surprised that some of the administrative burden, the EMR, in fact, didn't bear out as an independent risk factor, especially as it dominated a lot of the free text we received. And so, in addition to the survey tools that we circulated, we had focus groups that were moderated a year ago. And there were some other themes that bore out from that work that didn't necessarily get corroborated in this data. But about 80% of our free text comments focused on the EMR specifically. And so even though it may not be an independent predictor by the analysis, I do think it's a real problem. Okay.
So did you have any uplifting or positive findings from your study? I mean, it was really, I think a little bit sobering,
Yeah, I agree with you. So I have mixed feelings about that. I think it's really important for us to recognize the data. It came from our membership, and the SVS is fully committed to our membership. I think the uplifting part about this work is simply the opportunity that we have as a specialty. And so I commend the SVS for kind of tackling this head on. Putting out negative statistics about our specialty doesn't help our brand, doesn't help us with recruitment. But I think what's commendable and what is helpful is to recognize you've got leadership and membership really advocating for our workforce behind the scenes, doing really important work. And so putting such an uncomfortable topic in such a high impact session of the VAM is a pretty powerful statement from our leadership suggesting, hey, we've got a problem and we recognize that. And some of the solution is going to be a bit of an uncomfortable culture change. And that happens at a lot of different levels. My sense is that what the SVS can do for its membership is support it, and specifically support it with community, support it with peer support it with branding and value that allows us the opportunity to negotiate for system level support back home, to increase the efficiencies that we have in our everyday lives and our autonomy as vascular surgeons to do the job that we do so well, because what we do is special and what we do is valuable, all of us.
Well, I think that's very well said.
And did you look at any of the kind of independent drivers on this as far as types of practice for surgeons, academic versus community, size of their practice?
Yeah, that's a great question. So I was almost certain that there would be a difference in burnout based on practice type. And I only say that because as an academic surgeon myself, a lot of what I derive joy from at work is related to teaching and interfacing with the future workforce and answering scientific questions that help advance the care of our patients. I also am surrounded by a big group of partners to support me. And so I felt that being in an academic setting might be protective. But in fact, we really didn't see any association of practice setting with any of these outputs, burnout, depression, or suicidal ideation. Additionally, gender didn't bear out as a risk factor, with the exception being suicidal ideation, and that women seem to have twice the risk as men in this series. And while I think some of what I've received at the podium in presenting this data in different formats and different forums is that this is a problem of our contemporary generation, or our millennials, or the junior surgeons in the group. We actually found that increasing age seemed to be a risk factor that bore out, and this actually did not, in fact, seem to be higher risk in the younger surgeons.
Well, we want to thank you. This is really very important work, and I think I would echo what you say. I think that the fact that the leadership is open and willing to discuss this is really very encouraging. So, but thanks again for joining us today.
Great. Thanks for what you're doing. Thanks for having me.
I'd just like to let our audience know of a way to support our podcast. Our team is committed to providing free, high-quality, unbiased content to our listeners. We currently do not take any funding from industry sponsors or advertising, and we hope to keep it that way. So if you want to help us keep bringing you great content, go to audiblebleeding.com/support and find out how. We'll put a link in our show notes.